Good evening. It is with great honor that I welcome you to the 2018 Graduate Nurse Pinning Ceremony for the presentation of graduate nurse pins. Tonight's ceremony is a tradition within our profession and symbolizes the formal acceptance of these graduates into the nursing profession. In addition, it indicates the completion of your nursing education and the beginning of lifelong learning. These 21 graduates have worked long and hard to be here tonight, and we are fortunate to have all of you here to share in their tremendous achievement. We will commence tonight's ceremony with an invocation by Sister Juliana, our college chaplain.
Student nurses, soon to be graduates. Fortitude. It may not be in your spoken vocabulary daily, but for certain you've practiced it every day of your journey to become a nurse. It means strength for sure, but more than in the context of the muscles you've studied, it is the strength of determination, of asking for help, of being ready to take a calculated risk, and of setting value-based priorities. My prayer of invocation is that you will have the fortitude to become the best in your field of expertise. Friends, families, instructors, colleagues, and the entire Jefferson community hold you in esteem as you receive your pin and recite your pledge this evening. Amen.
It's my pleasure to introduce the president of Jefferson Community College, Dr. Ty Stone.
Good evening. Distinguished guests, faculty, family, friends, and students. Welcome to Jefferson Community College's Nursing Pinning Ceremony. This is such an exciting time for these dedicated individuals, and I am so proud to be here celebrating with them. Soon-to-be graduates, this is not the end, but the beginning of the journey in the selfless profession of caring for and comforting others. Hard work, commitment, and fortitude, and I didn't share that with Sister Juliana, of your life's calling is what got you to this point. And it is what you must continue to remind yourself of as you progress through this great but challenging work throughout your career. Up to now, you have spent countless hours poring over the endless assignments and lessons and rotating through a variety of clinicals that were created by our faculty, all carefully designed to ensure your future success as a nurse. I'm sure there were long days and sleepless nights, as well as smiles, and yes, even a few tears. You sacrificed a lot to get to this point, but you persevered and made it through. We all applaud you and your commitment to finish what you started. Of course, this is not the end of your development into the extraordinary nurses you will become. There's much more work ahead, but you are well prepared with the skills and knowledge gleaned at Jefferson, combined with your own compassion and strength. Along with your families and friends that supported you to this point, please also remember that you have all of us here at Jefferson Community College cheering you on. We will always be a part of your extended family, and we are always here for you should you need us. Go on to do great things, nursing graduates. We salute you.
would now like to introduce our special guests, professional staff, nursing faculty that are joining us this evening. You just heard from Dr. Ty Stone, our college president. We also have with us this evening Tom Finch, Vice President for Academic Affairs. Dan Dupe, Vice President of Finance. Linda Dietrich, Associate Vice President for Math, Science, Technology, and Health, and Nursing. Dr. Katie Troyster-Trait, Interim Dean of Students. And you've met Sister Juliana, our college chaplain. I now would like to introduce the faculty. Julie Soul, Director of our weekend program. Jody Pierce, your keynote speaker this evening. Cassandra Woodrick Phillips. Dr. Morgan Crump, our laboratory coordinator. Katie Hoyston. And Kim Honeywell. We also have a tremendous adjunct faculty that help us a great deal. Erin Finney. Desiree Fuller. Shannon Phillips. Jen Castle. Katie O'Brien. Dr. Deborah Marcella. And also with us this evening is Julie Roy. A special thank you to each of you for all that you do to support our nursing program and students. I would now like to invite Kristen Farmer to the podium to introduce our keynote speaker.
Well, hi, good evening, everyone. I would like to start off by saying thank you all so much for joining us on this very special night. I know these past 2 years have been quite long for most of you out there. Tonight I have the honor of introducing to you our keynote speaker. She is just one of our many inspiring nursing instructors here at JCC who welcomed us 2 years ago and has watched us grow into promising nurses. I'm honored to introduce to you all Johanna Pierce, or as we've always known her as, Jody. So let me just tell you a little bit about her. Jody received a Bachelor's of Science and a Master's of Science in Nursing Education from Lemoyne College in Syracuse, New York. She has been a staff member and nurse involved in direct patient care for most of her professional career and has worked in a variety of areas, including intensive care units, medical surgical units, operating in procedural rooms, and also in interventional radiology. Her passion is and has always been cardiothoracic critical care nursing, however. And if there's anything we've learned about Jody, it's how much she loves chest tubes and trach care. As a nurse educator and preceptor for new nurses in these areas, she discovered her love for teaching and training a new generation of nurses. While working full-time, she also taught nursing part-time here at Jefferson, and in 2012 accepted a full-time teaching position in which she continues to inspire all of her students in the classroom and clinical setting. Jody is an active member of the Central Professional Nurses Association, the American Association for Critical Care Nurses, the National League for Nurses, the American Nurses Association, and is also a valued member of the Honor Society of Nursing, Sigma Theta Tau International. She currently resides in Watertown with her beloved pets. Like nursing, she has always had a deep and lifelong love for animals and hopes one day to work at an animal rescue sanctuary. We've enjoyed her many stories about her beagles, cats, and birds over the past 2 years. She also enjoys reading, teaching, and spending time with her family and friends in Georgia. And let me just say, as a person who hates flying, I have never met another soul who loves airplanes and flying as much as Jody, or Marshmallow Peeps for that matter. I would also like to say this evening that not only has Jody aided in making our dreams of becoming nurses a reality over these past 2 years, the real masterminds behind our success, I'm proud to say, is our entire JCC nursing faculty. After spending more time with peers, clinical, lab, and lecture instructors than our own family and friends, I have proudly learned that behind every great nursing student is a patient, motivating, and encouraging nursing instructor. The faculty here has challenged us, prayed for us, and stressed out over our grades nearly more than we ever have. They taught us values that go far beyond NCLEX strategies and the nursing process. You are the nurses that we aspire to be like. You are the nurses who have raised us to be successful. Thank you for holding us to the highest standards of excellence to make sure we reach our full potential as caregivers. You will all always hold a special place in our hearts forever. And to all of my dapper-looking classmates out there, I want to say, as we leave our flagship this evening, I want you to always remember what Jody has drilled in our minds forever, that whenever in doubt, always follow the patho. Thank you.
Good evening, family, friends, faculty, and honored guests, but most of all, our graduate nurses. I first want to say how honored I truly am to have been asked by the graduating class to be their speaker tonight, and I share this honor with all of the faculty and nursing staff here at JCC. You have touched our lives just as much as we have touched yours. I cannot think of any better way to end the semester than to tell each of you how proud I am and how proud we all are to have been a part of your nursing journey. For the families of our graduates, I want to say a special thank you for supporting and encouraging them through these last 2 years. It has been a journey for you as well as for them. I know it has not been an easy journey because, as you may have expected, I've been there. You have gone through an arduous academic and professional journey, one that can only be successfully navigated through hard work, diligence, and determination. The nursing curriculum is a very intense and complex curriculum, yet through thick and thin, through the joys and through the challenges, you have persevered. 2 years of hard work and sacrifice are at an end, and a new journey is beginning for you. Build on what you have already learned and accomplished. Nursing is a golden key to opportunities, locally and globally. Be flexible. Take advantage of all this great profession has to offer. It's vast and ever evolving. Having said this, I'd like to give you a little history about the pinning ceremony being held here tonight. This is a rite of passage that can be traced all the way back to the 12th century Crusaders, when the Knights Hospitallers were honored with a Maltese pin for caring for injured soldiers. Back to 1860, when Florence Nightingale was honored with the Red Cross pin in her recognition for tireless service to the injured during the Crimean War. And back to 1880, when a class of nurses at the Bellevue Hospital in New York City were the first pinned nurses in the United States. So now, class of 2018, this is your pinning ceremony and your time to join this most honored profession. It is an accomplishment and it is an occasion to honor you for the successful completion of the first major part of your education as professional nurses. And I know you're all gonna go on. Every time you wear the pin, you remember the faculty, the staff, and your colleagues of Jefferson Community College, the nursing program, and everyone else. We were a part of your journey and your professional life story. Your nursing pin will remind you that from now on, your purpose is threefold: to care, to advocate, and to lead. In other words, you are now a care professional and you're a provider. You advocate for your patients, and you're a leader in any setting that you may find yourself. Now, when you care for your patients, do so with diligence, professionalism, empathy, and humility. Attend to them with respect, compassion, and without being judgmental. Listen, and remember that many times you will need to listen more than you'll need to talk. You will be surprised that you can learn from your patients as much as they from you, if you truly listen. And what you learn from them may be the very knowledge you need to provide the best care for them and for others in similar situations. Remember, trust and honesty will nurture your relationship with your patients and their loved ones. It is a bond that you will see them and yourself through times of joy and times of sorrow. Be wholly aware that you are entering a profession that has ranked first among all professionals for honesty and ethics in the past 16 years in a row. According to the Gallup poll, 82% of Americans rated nurses' honesty and ethical standards as high or very high. The next closest profession to us were pharmacists, who were 20 percentage points behind us. So, class of 2018, as you care for your patients, always remember that your patients and their loved ones are counting on your integrity and your honesty to care for them. I would like to conclude tonight by sharing an inspirational quote that has stuck with me and one I feel that is completely appropriate to send you off into the nursing world. Think deeply, speak gently, love much, laugh a lot, work hard, give freely, and above all else, be kind. I want to congratulate you, and I want to thank you for a great 2 years. So congratulations and have a wonderful night.
Thanks, Jody. That's great. We'd now like to present a few awards to our students, if we could. The first one is the Deborah Marcella Excellence in Nursing Award. Deb, would you come up and join me, please? Fortunate to have Deb with us this evening. Dr. Deborah R. Marcella Excellence in Nursing Award was established to recognize a graduating senior student who demonstrates dedication and passion for the profession of nursing. Dr. Deborah Marcella was a graduate of our JCC nursing program, class of 1970-something. She returned to her alma mater as a member of the JCC nursing faculty in 1985 and was nursing department chair for 12 years. Under her leadership, this program has gained a reputation for maintaining high standards and preparing outstanding nurses for the community. Dr. Marcella was also named Professor Nursing Emeriti in recognition of her commendable service. She was the first nursing member to get this award. This award is given to a graduate nurse who rises to the standards of excellence as demonstrated by outstanding class in clinical preparation, compassionate and creative patient care, exceptional communication skills, support of student colleagues, and unfailing advocacy of patient and family. This year, we are pleased to award the Deborah Marcella Excellence in Nursing Award to Kirsten LaRue. Our next award is from Samaritan Medical Center, and I would invite Deidre Sorrell and Wendy Server, sorry, I messed that up, to come to give this award.
Thank you. Wendy and I are happy and honored to present this award from Samaritan, and both of us have sat in those seats. My experience was 24 years ago, and Dr. Hess, Dr. Marcella, we're here, and so you will survive, is what I'm here to say. And maybe stand on the stage someday and proudly present this award. Samaritan, several years ago, as a nursing division, decided that we really needed a theory or a practice to guide us. So we decided that we studied many of the theorists, and Gene Watson was the theorist that we chose. Gene Watson really stands behind the practice that we commit to creating a culture that values excellence in patient care and services. And through this guiding, for Gene Watson guiding us, we've developed many programs: Samaritan Excellence, Samaritan Spirit, and many of you, certainly all of you, have been there. We've seen faces that we've seen every day. You can see that through the years we've used this guiding practice as a way to make our experiences better, our patient experience better. The heart value, this is what this award is, stands for honesty, empathy, accountability, respect, and trust. And you've heard that in every speech tonight. This caring theory guides us and fulfills these values. Tonight, Wendy will explain to you what this award is about.
Good evening, everyone. The student chosen by the faculty for this award clearly and consistently demonstrates the caring characteristics of the heart values. That caring is more than providing physical and fulfilling assigned tasks. That caring is an integral part of everything the nurse does, and that this is the intention of the nurse. That a caring and healing environment is the foundation of exceptional nursing care. That listening to what the patient and family desires, in addition to what they need, finds meaning in what she or he does. The recipient of the American Heart of Nursing Award for 2018 goes to Sarah Rillera.
And if anybody knows me, knows that I love to take a microphone. So before I give this away, I just want to say one thing as nursing leaders, and I hope that it just resonates with you, and it's just something to think about. Take responsibility for the energy that you bring to work every day. It is important to your parents. It's important to your colleagues. It'll make all the difference in your career. Thanks.
Our next award is the Star Award in memory of Dr. Walter Atkinson. This award was established by the Kennedy family And many years ago, Muriel Kennedy prepared this following words to be shared at the presentation for the Star Award. A very wise person once made this remark: "My purpose in life is to make it possible for every living person to develop to his or her own potentialities in the greatest measure and to live creatively according to his or her own achievements." Dr. Walter Atkinson, you're here. Pam. That's okay. Come on up. This is Pam Kennedy, who was going to give the award. and we couldn't.
Isn't supposed to start at 7?
No, we started at 6. But you know what? I'm glad to see you. Deb and I have been watching for you.
Oh.
So,
I am I cannot
la-
believe this.
ladies and gentlemen, Mrs. Pam Kennedy.
Oh, I cannot believe this. Okay, the person. Oh, this is so embarrassing.
That's all right. Here.
I mean, really.
And there's the person's name.
Okay.
I'll leave it right there.
Okay, I've got to collect myself here. You know, I'm looking out there going, where's everybody? Oh. Okay. I've got to, there it is. Okay. Oh, I'm glad my in-laws are not here. Okay. Okay. We're going to start from the beginning. You lucky people. Okay. In past years, my in-laws, Dr. John and Muriel Kennedy, continued the Star Award tradition started by Dr. Walter Atkinson in 1944. Both gentlemen practice ophthalmology here in Watertown, New York. And tonight, I am very happy, a little late, but I am happy to continue the tradition by reading the speech written by my mother-in-law, Muriel. A very wise person once made this remark: "My purpose in life is to make it possible for every living person to develop his or her own potentialities in the greatest measure and to live creatively according to his or her own achievements." Dr. Walter Atkinson practiced that philosophy all his life. He did all that he could to encourage everyone whose life he touched to do his or her very best always. In the early days of the nursing school at the House of Good Samaritan, he established the Star Award to reward that excellence of achievement. It carried monetary value, but more importantly, it gave the person who earned it a star to wear attached to the nursing pin, so that all the world would know that that person had developed at that time his or her potentialities to the highest level. When Jefferson Community College started its nursing program, Dr. John and Muriel Kennedy wanted to carry on the tradition started by Dr. Walter Atkinson. They established a similar award here at Jefferson Community College. At that time, Dr. Atkinson was still alive and attended several of those first pinning ceremonies with the Kennedys. Tonight, I present the Star Award in memory of Dr. Walter Atkinson and Dr. John and Muriel Kennedy to Amanda Collins. Oh, I'm such a dingbat. No. Anyways, this is for you, and then here's your little star that you can put right in there and attach it to your pin.
Thank you.
Congratulations.
Thank you.
I would now like to invite Katie Hoyston to the podium to present the Mercy Hospital School of Nursing Alumni Award.
The Mercy Hospital Alumni Award was established to honor a graduating senior who exemplifies the tradition of the Mercy Hospital School of Nursing. This tradition is based on the mission of Catherine McCauley, the founder of the Sisters of Mercy, to care for the sick and the poor. The School of Nursing, which closed in 1970, embodied the values of the Sisters of Mercy of excellence, caring, and service to the sick. It is these values that we recognize tonight. I am honored to be here tonight to present this award on behalf of the Mercy Hospital alumni to this most deserving graduate. This year's recipient of the Mercy Hospital Alumni Award is Tricia Ackerman.
Our next award is the Marion Brennan Personal Growth of Nursing Award. We are very honored this evening to have Marion Brennan's daughter, Cynthia Quackenbush, there, and Mrs. Brennan's granddaughter, Christine Comiletti. We are grateful to the Brennan family for their continued support of our program. I'd like to invite Cassandra Woodrick Phillips to the podium to present these awards.
The Marion Brennan Personal Growth in Nursing Award was established in 2003 to recognize a graduating student who has demonstrated outstanding growth in character, personal development, and skills while pursuing a nursing degree at Jefferson Community College. The award is given in honor of Marion Willie Moody Brennan, a 1973 graduate of Jefferson's nursing program. Mrs. Brennan earned her degree at the age of 53 after raising 9 children. As a registered nurse, Mrs. Brennan worked at Carthy Gerry Hospital until her retirement from the position of head nurse in the maternity department, where she also served as a Lamaze instructor. Mrs. Brennan believed that one should value each person's worth, treating everyone with respect and inspiring each to do their best. Education is all a person lacks to become the best that they can be. Mrs. Brennan passed away on January 2nd, 2003. She would certainly be pleased to know that in her memory, a nurse's achievement will be recognized. The Jefferson Community College Nursing Department and the Jefferson Community College Foundation are grateful to the family of Marion Brennan for establishing this award in memory of this outstanding nurse. This year's recipients of the Marion Brennan Personal Growth in Nursing Awards are Kathleen Green and Cody Fields.
Thank you, Cassandra. I would now like to introduce Matthew Barrington, who will present the class reflections.
So, first and foremost, congratulations to the JCC class of 2018. While we have worked hard and diligently to be here on this night, we would like to recognize that it is our family and our network of friends in this room tonight that have provided us with the love, the support, and the encouragement that has sustained us throughout our educational journey these last 2 years. We humbly, sincerely, and with utmost gratitude thank you all on this day. As our family and friends know, over the last 2 years, our lives have run the gamut of emotions. Together, we have laughed, we have more often cried. We've been worried and fearful at times, but ultimately, we have felt tremendous joy and happiness looking into the future. Together, we have persisted, and together, we have endured. We share our achievement together with you here tonight. For those of you who were unable to witness our journey firsthand, we would like to offer you an insight into our lives as nursing students. So it all began with a letter in the mail that we all screeched at that read, "Congratulations, you've been accepted to the JCC nursing program," with a slight caveat. Contingent upon completion of a medication calculation examination with a score of 100%. Before class even started, we had an exam. Welcome to nursing school. We picked up our reading from the bookstore, which included no less than 23 books, several of which were 2,000 pages in length, altogether weighing more than some of our small children. We wondered how we could ever read that many pages. We checked our course manual to see our assignment for the very first class. Read 18 chapters. Welcome to nursing school. We picked up our new uniforms and tried them on proudly, despite the pleated men's shirts that we were pretty sure were women's. And of course, there was finding that pair of 100% absolutely white shoes with no other colors, stripes, emblems on them, even on the bottom. Before the semester began, we walked into our Jumpstart orientation largely as strangers. We were told in this pep talk/reality check with Lisa and Marlene, both congratulations and that we may be entering one of the 2 most difficult years of our lives. Even those who had served in the armed forces later came to think that perhaps this wasn't a bluff. They told us that we may have to miss out on some things in our lives, but to hang in there and all of our hard work would be worth it in the end. This was our new mantra. So we began with the fundamentals in 111 with Kim, with her scooter and boot, who at the last minute took on teaching the entire semester of course material instead of co-teaching as was planned. We read and studied those 100 pages from our Taylor book. We went to our first clinicals, and we experienced our first critical elements, where I think we all personally experienced heart palpitations long before we would actually study them. We learned about bed baths and beyond. We had concept map workshops. We learned in length about the nursing process: assessment, diagnosis, planning, intervention, evaluation, wash, rinse, repeat. And we also learned about nursing diagnoses. And before long, we were diagnosing ourselves. For example, anxiety related to critical elements, exams, BTIs, as evidenced by tremors, elevated BP, and palpitations. or fatigue related to clinical preparation as evidenced by bilateral ptosis, decreased LOC, and yawning. And of course, there's imbalanced nutrition, more than body requirements, related to stress eating as evidenced by accelerated weight gain. You've heard about the freshman 15. Try the nursing school 90. Last, we inadvertently learned about nursing student syndrome, wherein students believe they have the ailments which they're studying. Stephanie had the most severe case throughout the program, and in the first semester, she was sure that she had a brain tumor. MRIs revealed, thankfully, she did not. Those of us who moved on to our second semester felt optimistic and proud to be forging ahead on our journey. We felt we had a grasp of how things were going to go. We were mistaken. We got our first real, true patient assignment in 112, and nobody knew exactly what that really entailed. As we stumbled into pre-conference at 6 in the morning, narrow-eyed and not so bushy-tailed, we compared the times we went to bed the night before. 2 a.m., says one. 3 a.m., said another. And there was one in each group, Cody, clutching a cup of coffee, saying, "I haven't gone to bed yet." We got better at preparing for clinical, and we learned all about patient assessment, IV therapy, pre- and postoperative care, musculoskeletal and neurovascular assessment, and immobility and cast care. While on the orthopedic floor, Stephanie misdiagnosed herself, this time with a bone tumor. We progressed from 5 nursing diagnoses to 15, and we actually felt like we were getting somewhere. Until maternity. In maternity, with Cassandra, we observed the beginning of life, with newborns literally taking their very first breath. She taught us the ins and outs of our ins and outs. It didn't take long for Stephanie to diagnose herself with cervical cancer, another false alarm. Our emotions were tested as we watched new mothers and fathers hold their babies for the very first time, and also when we provided care to neonates who were desperately ill and depended on nurses for their survival. On a lighter note, in class, we learned how to meditate, how to give a therapeutic massage, how to breathe in flowers and blow out the candles. We won't forget veal chop for fetal accelerations and decelerations, and of course, when in doubt, we will always massage the fundus. We knew that the third semester would be the toughest semester we would face. We would spend countless hours crammed in the library study rooms and make lifelong friendships with many of the delivery drivers from Cam's Pizza. Psychosocial nursing required a whole different set of skills and confronted us with many new challenges. There was this new concept of therapeutic communication and process recording. Katie led us to discover these psychosocial tools, as well as a myriad of psychobiological disorders and trauma interventions, often through an exercise of role play. Our 12-hour clinicals gave Stephanie the time to diagnose herself with a personality disorder, and for the rest of us to be involved in leading group therapy and assisting with recovery, not to mention playing apples to apples and eating therapeutic graham crackers and peanut butter. In 231 MedSurg with Julie and Jody, we learned the realities of becoming a nurse. We tested on IV push medications, where we learned that Protonix an anti-ulcer medication would, for us, ironically, have the opposite effect. We also studied diabetic medications at length, blood transfusions with fresh frozen plasma, and gastrointestinal therapies. As for Stephanie, this time it was hypothyroidism. Jody would teach us how to be like the predator when entering patients' rooms. She would remind us that, well, that's just the way the ball bounces, and never to call a doctor with egg on our face. And for the love of everything holy, follow the patho. From here on, many of us in a difficult situation would look inward and ask ourselves, WWJD, what would Jody do? In addition to Psych and Med-Surg, we also had a pharmacology class thrown in the mix. We learned with Julie Roy, from her worksheets to her case studies, what seemed like every medication known to modern man. We learned basic clinical pharmacology for drugs across the lifespan, including neuropharmacology, muscarinic agonists and antagonists, cholinesterase inhibitors, adrenergic agonists and antagonists, CNS drugs for neurodegenerative disorders, local and general anesthetics, opioid analgesics, opioid antagonists, non-opioid centrally acting analgesics, antipsychotic agents, antidepressants, sedative hypnotics, central nervous system stimulants, diuretics, calcium channel blockers, beta blockers, vasodilators, antihypertensive meds, heart failure meds, antidysrhythmic drugs, anticoagulant, antiplatelet, and thrombotic drugs. And that was just for the first test. Or at least that's how it felt to us. Now that it's all over, we can say thank you for holding us to a high standard. Our fourth and final semester, feeling so close, yet still so far. Competence and confidence began to prevail, and we all started to feel like nurses. We could see the light at the end of the tunnel, but we were still cautious that the light could be from an oncoming train. We were starting to be amazed at just how much we had learned since we started. Stephanie diagnosed herself this time with vitamin D deficiency, and I'm proud to say that this time, ladies and gentlemen, she was right. We experienced our pediatric rotation at SUNY Upstate. We were driven to Syracuse by Aaron and Desiree before dawn in our white JCC chariot with non-functioning windshield wipers and locks to boot. If you forgot your government-issued picture ID, Tim's dad might be your only hope. We each had a special pediatric client that again pulled at our heartstrings and challenged, once again, our strength. After this rotation, we continued to take on more critically ill patients and were able to experience nursing in settings outside the hospital. We were fortunate enough to have Dr. Deborah Marsala come back to teach our seminar course, where we gained insight into transitioning from students to the workforce. We will remember that it was you who took us to Albany to lobby our state representatives to vote in line with the New York State Nurses Association in favor of safe staffing legislation, because safe staffing saves patient lives. In our last round of Med-Surg 232, a 10-credit class, we learned about the artistic talents of Dr. Marie Hess. We could now draw a nephron tubule better than anyone. We know that although all the answers to a question may be correct, we must pick the bestest. And to prioritize the patient who is more worser. she taught us about feelings and how to avoid poor spells, and that you never want to end up D-E-D. We will always remember that in third-degree heart block, the AV node says no. We appreciate Dr. Hess's willingness to take our class under her wing and teach us in what was then a time of uncertainty. Moreover, we are so very grateful that you continued on as the interim department chair, working tirelessly for this program and always putting students' needs first. We don't know what we would have done without you. As the weeks rolled on, our instructors became our mentors, and our classmates became our family. We all came from different backgrounds and walks of life with the hopes and dreams of becoming nurses. We lost half of our closest friends along the way, which felt like losing part of our family at times. No matter what was going on in our personal lives, we continued to follow the path of becoming a nurse. Many times, this path was lit by our instructors, and although we may not have said it at the time, from the bottom of our hearts, from the apex of our myocardium, we thank you. Your abilities to demand critical thinking, Julie Soul, and provide us with engaging challenges has transformed our clinical knowledge and skills. We are sincerely grateful to have had all of you as our teachers and mentors for your assistance, support, knowledge, and expertise, but most of all, for your belief in us. We are talking about you, Desiree Fuller, Erin Finney, Jen Castle, Samantha Coulter, Fern Corp, Katie O'Brien, Katie Heuston, Kim Honeywell, Dr. Morgan Crump, Jody Pierce, Julie Soul, Cassandra Widrick Phillips, Heather Barbin, Dr. Marsala, and Dr. Marie Hess. From all of us to all of you, thank you. So, tonight marks the end of a journey, and of course the beginning of a new one. Wherever life takes this flagship class of 2018, and whatever we may do, we will always hold within us these times where we walked together, where all of you turned all of us into nurses. Thank you.
Thank you, Matthew, I think. Very good. Thank you so much. We will now enjoy a slide presentation by the graduating class of 2018. I thought you said you worked, all you did was work hard at that. Looks like a lot. We will now have our presentation of our graduate nurse pins for the graduating class of 2018. Will Erin Finney please come forward? And I would ask the Erin Finney's clinical group, please step to the stage. Victoria Carfella. Eva Fox. present to you the graduate nurses of Jefferson's class of 2018. Tonight, Sister Juliana will now give this evening's benediction.
Nurses, much has been entrusted to you, and fortitude, it's there. Thank you for sharing your words and pictures of gratitude at the opening of tonight's ceremony, and for your heartfelt expressions to your instructors, your mentors, your guides. Carry the words of your commitment in all you say and do. May you know God's blessing always. Amen.
Please remain seated until the graduate nurses have exited the theater, and then please join us in the Commons area for some refreshments.